Department of Higher Education has revealed its readiness plans in helping public and private institutions to vaccinate eligible staff and students. This follows the Department of Health's announcement that the 18 to 34-year-olds may register to get vaccinated. To take a look at this, we're joined by Chief Executive of Higher Health, Professor Ramneek Ahluwalia. Good evening to you, and thank you so much for your time. Talk to us about your readiness then to be able to vaccinate this group. Have you had any take up this offer so far?
Good evening, Bogiwe, and good evening to everyone. Bogiwe, absolutely, higher education or post-school education is a space where we have the young people, and that's where the young people are in huge numbers. South Africa in general is a young country, and Africa as a continent is a youthful continent. And if you really ask me, if we have to really win this pandemic, or if we can really tame this virus, this is the phase where the young people vaccination will decide the fate of us as a continent, as a country, and including post-school education has to play its major role if we have to tame this virus. The new variants absolutely love young people. They have affinity to youth. Their new variants have shown that. The Delta variant has shown it very clearly. And young people are vulnerable. They give that space of exactly what the virus wants to move from one human to the other. And it keeps moving, surviving in human bodies, finding a body, starts mutating and develops into a new variant, where the wave starts for us. And that's exactly what we need to break. And this is an absolute opportunity where we can now tame this virus, because we can actually destroy what exactly the virus wants. So I think we've got an opportunity in post-school education. We've got about 2.5 million young people, and through your medium, I'm appealing to them, calling on to them that this is the time. And we've got a major plan ready now for how we're going to vaccinate in a youth-friendly way for our young people, so that we can attract more and more young people in a more easy way to vaccinate. So rather than bringing young people to the vaccine sites, we are working on bringing the vaccines to the young people. And I think that's the best strategy we could follow at this stage. And that's exactly we are preparing every campus in South Africa. And Bongiwe, my biggest point will be is that these are 2.5 million educated young South Africans. And if they can get vaccinated as numbers as possible, not only will break the chain of the virus as we want to do, but more than that, we can actually educate our communities very well through them. They are going to go back to the same families where they have other young people, their peers, their elderly, who are fighting vaccine hesitancy, who are not coming up in numbers the way we want. And so I think we can achieve a lot if we reach out to our educated young South Africans and get them vaccinated, and through that strategy, get our country vaccinated.
Am I hearing you correctly then in saying that the more young people are vaccinated, it could determine the trajectory of the pandemic?
Absolutely. Now, the science is very clear. The current Delta variant loves to bind. So what's happened is this new variant has a high affinity to our human body, our human cells. So if it binds very well, it replicates very well. So the viral load increases. And when the viral load increases, it spreads very quickly. So the transmission is very quickly. And when transmission is quickly, if more and more people are in close vicinity, the virus is spreading more faster to humans. And that's what virus is enjoying, because all the virus is trying to do is keep on finding its way to survive in human body, all the way by becoming more transmissible. And that, if we can vaccinate our young people, we will give the body a huge immune response in such a way that we can actually make sure that the virus does not, and our immunity overpowers the virus, a high viral load or transmissibility rates. And that is where the vaccinated people, and moreover, vaccinated people also have a very high chance, in fact, all vaccinated people are showing no hospitalizations, are showing very minimal ICU, or showing absolutely no death. So our hospital overloads will come down very drastically. We can overpower this virus. The virus will tame down exactly what we've seen in UK, what we've seen in other parts of the world, in Europe, who have been able to vaccinate the young people faster than we could. And this is an opportunity for Africa.
And how? And what measures have been put in place to deal with hesitancy, especially among some students? Because we saw research from Afrobarometer not so long ago that was suggesting that it's people in the urban areas who may actually not be keen to take the vaccine, and this might also include some young people. What measures then have you put in place to address some of these concerns that they might have?
So a three-way approach. The one is we got an army of about 16,000 foot soldiers, which is peer educators. They were built for HIV fight in the post-school system. They were built for, we've seen a brutal death of young girl on gender-based violence. And this is exactly, this foot soldiers or peer educators are built so that we educate peer-to-peer. There's nothing better than a peer-to-peer talking about vaccination. So if we build this cohort who understands through science, through data, the difference between the death rates in a vaccinated population versus a non-vaccinated population, it is absolutely clear from global data, even in South Africa, that people who are vaccinated have absolutely shown no death. They're very negligible numbers even in the hospital admissions, compared to all the people that are being actually right now in the hospitals or suffering in the ICUs or dying are predominantly the ones who are non-vaccinated. If such data, such scientific clearance, understanding to them about the science of how the vaccines are made, how these new clinical trials helped us to understand how quickly we could penetrate this virus, we could understand the virus scientific genomes and build a vaccine that can actually stop the virus or tame the virus down as quickly as possible and build our immune system to fight this virus, our young people, our educated young people, will actually become the biggest force that will fight this vaccine hesitancy. So we use the peer-to-peer approach. And the first cohort of young people who are going to get vaccinated from South Africa, from our post-school education, will be the force to start saying to even the educated, other educated young people, or people who are in schools, or young people who are at home, who are not following the science, and these people will go and mobilize for us. And second is through yourself, as good media, you are really helping scientific world, you're really helping us to get to the people, explain the science of this virus in the most easiest possible way. And you're doing a brilliant job. And we appeal to all the media houses in South Africa. This is a good time for us to appeal to young people. They are the game changer for this continent. They are going to be the game changer of this. And the last strategy is what I said, make vaccines more youth-friendly. Bring vaccines more closer to the young people. Make them more accessible vaccines for the young people. And that is exactly what the government is doing, what Department of Health has done, what the partner, the private sector is doing. And it's a collaborative effort of us, private sector, and everyone together in making sure that this becomes a movement. And this is the way we can actually lower down this virus as quickly as possible.
All right. Thank you so much for your time this evening. That was Professor Ramneek Ahluwalia, who is the Chief Executive Officer of Higher Health.